Traditional tumor treatments generally use radiotherapy, chemotherapy, surgery, etc., but due to the many side effects, patients are more painful. Interventional therapy is guided by medical imaging equipment such as DESA, digital subtraction angiography, specialized catheters, guide wires, and other precision instruments are introduced into the body, directly super-selected to the blood supply artery of the lesion. The catheter delivers more than 10 or even dozens of times the concentration of drugs than traditional intravenous chemotherapy. Further, increase the efficacy of treatment, reduce systemic side effects of drugs. Interventional embolization therapy is under the DESA, digital subtraction angiography, machine fluoroscopy to perform catheterization, introducing the catheter into the blood vessel at the lesion site. Through the catheter, embolic agents, such as coils, PVA particles, microspheres, gelatin sponges, etc., are injected into the target blood vessels to block the blood flow and the nutrient supply to the tumor, thereby shrinking the tumor or causing tumor necrosis. In tumor treatment, interventional chemotherapy and embolization therapy are often used in combination. Through interventional chemotherapy, chemotherapy drugs are delivered to the tumor site to kill tumor cells. At the same time, embolization therapy blocks the tumor's supply vessels, causing ischemia and hypoxia in the tumor tissue, thereby further improving the treatment effect. Interventional therapy are divided into vascular interventional therapy and non-vascular interventional therapy. Vascular interventional therapy differs based on operating principles, can be divided into interventional embolisms, intervention chemotherapy, and interventional chemembolization. Due to its precision, small trauma, and few side effects, it has become an important method of tumor treatment. Traditional surgery requires a larger incision, which results in greater trauma and postoperative pain. Interventional treatment is performed through a 1-2 mm incision, which results in less trauma and less postoperative pain. Traditional surgery requires general anesthesia, which can cause side effects such as nausea and vomiting. Interventional treatment uses local anesthesia and the patient will not experience obvious pain symptoms. Patients need a longer recovery period after surgery. Interventional therapy, on the other hand, is carried out under the supervision of medical imaging equipment, which can accurately reach the diseased area and achieve precise treatment. Various complications may occur after traditional surgery, such as infection, bleeding, thrombosis, etc. Complications of interventional therapy are relatively low and patients recover faster. Interventional therapy is widely used in the treatment of solid tumors such as lung cancer, liver cancer, breast cancer, pancreatic cancer, adrenal cancer, thyroid cancer, prostate cancer, etc.
Drug-eluting beats transcatheter arterial chemoembolization further improves the efficacy of traditional interventional therapy by combining embolization and drug-carrying functions. DEB-TACE have been used clinically in Europe and the United States for 20 years and are highly safe.
They are tiny spheres made of materials such as polymers or ceramics. The diameter is generally between 50 to 1,200 micrometers. Microspheres have good suspension, water absorption, and compressibility, which makes them good embolizing agents and drug-carrying functions. It can absorb anti-cancer drugs and maintain a high concentration of drugs released from inside of the tumor for a long time. Anti-tumor drugs are first loaded inside the microspheres. A catheter is inserted under the guidance of medical imaging equipment to guide the drug-loaded embolic microspheres into the blood vessels supplying the tumor. The microspheres have the same specific gravity as blood and can travel in suspension within the blood vessel. As the blood flows, the tumor vessel is blocked. The drug carried in the microspheres is released inside the tumor for over a month. It is in full and effective contact with the tumor cells and kills the tumor cells. The tumor will be in contact with the anti-cancer drug for a long time under the environment of hypoxia and ischemia and will be gradually apoptotic and necrotic. Compared to systemic chemotherapy and traditional interventional therapy, DEB-TACE has stronger targeting and can effectively deliver drugs to targeted tumor sites. Microspheres are permanent embolic agents, breaking through the bottleneck of traditional interventional therapy embolic agents that may drift or dilute over time. The drug contained in the microspheres has a long sustained release time, and the anti-cancer drug can be released continuously for more than 1 month with a long-lasting drug effect. At the same time, the local drug concentration in the tumor is high. The drug concentration in the systemic circulation is low. The toxic side effects are lower, and it is safe and reliable. St. Stamford Modern Cancer Hospital, Guangzhou is a joint venture of Singapore and China specialist hospital specializing in cancer treatment. The hospital is supervised by the Ministry of Health of China and has obtained the USJCI medical certification. It has 18 internationally advanced minimally invasive cancer treatment technologies and a professional MDT medical team, bringing new hope for cancer patients. St. Stamford Modern Cancer Hospital, Guangzhou has always been adhering to the service tenet of everything is patient-centered, providing high-quality medical services to every patient, and fighting cancer with all cancer patients.